All right, welcome to the Smart Choice Health Insurance Costs webinar. I'm glad that you're able to join me today. This presentation is sponsored by SDSU Extension. I'm Lorna Wounded Head, the Family Resource Management Field Specialist. My office is located in the Sioux Falls Regional Center, and I work with consumers across the state of South Dakota, providing education about resource management topics, specifically personal finance. During today's session, I will discuss the importance of health insurance, understanding your costs for healthcare, and what you can do to make smart choices about your healthcare costs. So today's goals are to understand why health insurance helps prevent large unexpected expenses, and to learn what to compare to understand the cost and coverage, and to identify information needed to make a smart choice. So to get started, I'm just going to go over a few statistics about healthcare costs. Healthcare costs, or healthcare, is getting more and more expensive every year. And there's some different reasons that the costs have increased. And part of that is our population growth and population aging. So as individuals are living longer. All right, so healthcare spending in the United States has increased, is in 2017, according to the study, was approximately $11,000 per person. And it's expected that in the next 10 years, up to 2027, it will increase to $17,000 per person. And so I was talking about that population growth and that population aging, and that is attributed to about 50% of the spending, in which due to increased costs for people who are living longer and aging. Chronic illnesses such as diabetes is the medical condition responsible for the greatest increase in spending. So as individuals are living longer, then there's more chances for them to maybe have some type of chronic illness as they're aging, and so then that increases the costs. Rising costs of the health insurance premiums this is a concern for many people. The average annual premium for healthcare coverage rose about 5% in 2018. We're also seeing higher costs out-of-pocket expenses, and part of this is due to a shift in the high deductible health plans. So so consumers are paying a higher deductible, which then automatically means more out-of-pocket expenses. The higher deductible plans then help to decrease the cost of the monthly premium, but in the end, there's that additional expense. And then another thing is where individuals are avoiding care. So rather than going to the doctor for maybe some well care checkups, they are avoiding those, which then, if there is an issue, a healthcare issue, could cost higher expenses a little bit later. So to get started in talking about healthcare costs, I'm going to share a story with you. And this story is about Jamie. And let's see, get my slides here. Jamie, like many of us, he is very busy, and with the duties of daily life, he's managing work and home. And Jamie is single, healthy, and trying to make ends meet. So health insurance just hasn't been a priority. Unfortunately, Jamie accidentally slipped, fell, and then had to go to the emergency room. And this fall was pretty bad, and Jamie needed emergency surgery for a broken arm. And this became a pretty stressful situation because Jamie was uninsured and had very limited savings. Jamie was preparing to move next month and had saved just enough money for the security deposit and first month's rent. Like Jamie, each of us has fallen, slipped, or tripped. Most of the time we are lucky, but sometimes a fall, slip, or trip can result in a broken bone, or worse, the cost of an injury can be surprising. This accident was something that Jamie hadn't planned for. However, Jamie recognized the very real cost of not having insurance when the bill arrived. Because of this experience, Jamie decided it was time to purchase health insurance, but was confused about how to make a decision. So I'm going to ask you, Emma, what do you think what was the total cost of Jamie's broken arm with no insurance?
$2,000.
$2,000. Okay, that's a good guess. But I'm going to take you through what the expenses ended up being for this kind of one-time incident. So first of all, the expenses initially added up at the hospital. After the fall and arriving at the hospital, Jamie was admitted to the emergency room, had to have blood drawn, had to have an x-ray taken, and then receive some pain medication for the surgery by the anesthesiologist. Finally, Jamie's arm was set and put into a soft cast by a doctor. So the initial expenses were over $7,000 because we have like $3,000 for the emergency room, over $2,000 for hospital supplies, and then for the pharmacy and drugs were over $2,000. Your estimate was a little low. Then for some follow-up visits with a specialist, this included getting a hard cast, 2 visits with the specialist, and then some x-rays. So adding over $1,000 more. So the total cost without insurance for this situation was over $9,000. So yes. So what surprises you most about like what you see on this chart here?
The emergency room, honestly, and the x-rays. Like, I don't know. I'm not from here, so I'm familiar with like the healthcare system in Europe and things like that. And it does not cost that much for like a broken arm, even for like the ER and all that. So it just doesn't make any sense to me. Like, why is the healthcare cost so expensive in the States? Even like with insurance or without insurance, it just doesn't make any sense to me.
You know, one thing to keep in mind that is part of some of these costs is the person that's actually providing the care. So like the emergency room doctor, the nurses, and that type of thing. And so you always have to kind of factor in like their expenses and not just maybe the equipment that's being used. So, but it does add up quite a bit. So this is just one example. Just one example just based on just a single event. And so the rates and charges may vary depending on maybe where we live or what doctor or what hospital we're going to go to. But looking at the expenses, so just comparing the costs with and without insurance. The middle column shows the costs without insurance, so the expenses that I just showed you on the previous slide. And then the cost with insurance, and this is just kind of a general insurance plan. This is not necessarily going to show every specific, or it's not going to be identical to every insurance policy, but so you always have the premium that you're going to pay on a monthly basis or an annual basis. So the premium, like for this insurance policy that shows is like $1,000 for the year. And then there's always the deductible, and the deductible is the amount of money that you as the consumer would pay before insurance kicks in. So in this situation, since it is kind of a one-time event or like the first event where insurance would be involved, then Jamie, if he had this insurance, would have to pay that $4,000 deductible. But then after the deductible is met, then your costs are going to be a little bit less, because the costs would be, after the deductible would be met, then for lab and x-ray, he would only have to pay 30% of the charge. But he has to pay all of that because his deductible is not met. And then for the emergency room, that's also 30% after the deductible. So he gets a little break there because he's met his deductible. Then for the office visits, which he paid $100, with this, he has a copay. And so then it's going to be $30 rather than $100. The specialist visits are also less because of a copay. And then the hospitalization, that $2,000 is less because of he's met his deductible. And then the outpatient visits are less. And whoops. Oh, shoot. Oops, one the wrong way. All right. And so, okay. So those are going to be the expenses, and, you know, kind of just being able to show the comparison. So on here, it's not showing the actual expense or the total amount, but out of pocket, he's going to pay quite a bit less. Okay, that's on the next slide. So looking at, oh, you have a question?
Yeah, so in the previous slide, like the monthly premium, and then yearly it's $1,000, and then the deductible is $4,000. So does my yearly, like that money, does it go anywhere? Does it count towards the deductible, or that's just like I'm paying and it doesn't count towards the deductible?
Nope, it doesn't count towards the deductible. So the premium is essentially what you're paying in order to get access to the insurance. So it would be the same thing like for your car insurance. You're paying that premium, and that just kind of gives you access to that insurance. But you point out something good, because, and I'm going to talk a little bit later about out-of-pocket expenses or out-of-pocket costs. And that is like, even though you have insurance, there's still going to be some costs that you have to actually pay kind of before insurance kicks in. Because it'd be nice that insurance covered absolutely everything, but it doesn't do that. So let me kind of just break it down a little bit. So this is kind of a similar type of chart, but we've added a couple other types of insurance policies. So this the second column shows those expenses with the $9,000. And then if he had this bronze plan, the cost of the broken arm would only be $5,000 for this plan. For this other one, the silver, just a couple of things to note, that the premium is higher, but you'll notice that then what he pays out of pocket is much less. And that has to do with a lower deductible, like $900 deductible rather than $4,000 deductible. And it covers a 20% after the deductible rather than the 30%. And then the copays are the same, but these percentages are a little bit less. So that means that like if this was you in this situation, you would pay almost half with this silver plan than you would with this bronze plan. And then you can see even with the silver plan, it's a little bit less. So the differences are kind of looking at these deductibles. So with this plan, your deductible is $500. So that means insurance, once you've spent $500 on expenses, then your insurance kicks in. But essentially, you're kind of transferring that financial risk, but you are paying more for a premium because your premium is over double what you would pay for this bronze plan. But you're kind of getting more coverage. So when we look at kind of making those decisions, and these might be some of the things, like if you were looking at your insurance plan, what this means. And sometimes people just look at maybe the cost of the premium, and like, this premium is going to cost me so much less, that this might seem initially like the best option. But what you also have to make sure you look at is your deductible, because this also has to be paid before some of those other insurance benefits kick in, such as with these other, like with the coverages for like the lab x-rays or the emergency room, just even office visits and that type of thing. Okay. So just looking at this chart, what are some questions you have?
I'm just so surprised with the cost.
Yeah.
But yeah, like you said, it does sound like auto insurance, but yeah, I mean, I don't know. Like, I don't think I would choose anything from here just because it's so expensive.
True, but and these are kind of just standard plans. I mean, you most likely would be able to find things that cost less, or so even cost more. But even just being able to think about, I mean, it's important to have health insurance coverage.
Mhm.
That's kind of the first primary thing.
Yeah.
Because as you can see, even if you have a higher premium that you're paying, you're going to save so much more money if you don't have health insurance. Plus, the other thing is, many times health insurance provides you with like kind of wellness checks. So like, you can go in and have a physical, and there's no cost for that. Or maybe you can get a flu shot and there's no cost for it. I know with even with the COVID testing, I had to have a COVID test. Luckily, it was negative, but the COVID test was $300, but my insurance covered all of that. So, I mean, that's just that's a nice benefit to be able to have. And, $300, if I'd had to pay that out of pocket, is more than what I would pay for that gold monthly premium. So kind of have to think in terms of that. And if you have like a major medical situation, even if like the monthly premium from insurance is expensive, it'll still usually pay off. So a little bit, as I get through this, I'm going to talk about maybe some options for you as a graduate student to look into some less expensive options for health insurance. So, but moving on, just to continue looking at the costs of insurance. It's important to be able to understand what the terminology is. And so some basic terminology, first of all, is premium, which I mentioned that already. That's the amount that you have to pay for your health insurance. And many times, if you have health insurance through your workplace, you share that cost with your employer. If you don't have health insurance through your workplace, then you have to cover the cost of that. So as you're job hunting or looking for jobs, you always want to look into see, what is the health insurance that's available for you, and then be able to look and see if that's a better deal than having your own. The other term that's important to know is deductible. So I've talked a little bit about that. And that's the amount that you owe for healthcare services that your health insurance plan covers before your health insurance plan begins to pay. So it's important to understand that it has to be services that your health insurance covers. And then the deductible is just subtracted from whatever that bill is. So just, looking back here, this is a $4,000 deductible. So this $1,000 is paid in full because the deductible is not met. But then once you get to that next expense, a portion of that expense is reduced because the deductible is met. And so your health insurance, you don't have to do any of that figuring out. Your health insurance does that. So this example I have on the screen, the deductible plan is $1,500. And so at the beginning of the year, and usually health insurance policies run in a calendar year, because she hasn't reached her deductible yet of $1,500. Her plan doesn't pay any of the costs for that office visit of $125. Jane has to pay all of that. And then co-insurance is another term. And in this example, co-insurance is 20%, but that's part of the cost of the covered healthcare service. It's the part of the allowed amount for the service. And you usually have to pay this amount once you've met your deductible. So on this previous screen, like this 30% would be the co-insurance. So that's the portion that you would have to pay, or this $30 is the portion you would have to pay. So in this example, Jane reaches her $1,500 deductible, and so then co-insurance begins. So that means that Jane pays 20%, any expenses over $1,500, she's going to pay 20%, and her insurance is going to pay 80%. And then out-of-pocket costs are your expenses for medical care that aren't reimbursed by insurance. So those include, and that includes the deductible that we've talked about, and that co-insurance, and then co-payments. So in this example, and there's always an out-of-pocket limit for the year. So her limit is $5,000. So once she has, had enough healthcare services that reach, like she's paid $5,000, then her plan pays the full amount after that. So it's not once you've had $5,000 in service costs total. It's I'd have to do the math to figure it out, but so 1,500 of that 5,000 is that deductible, but then the rest is that 20% of those services. So she may have much more than $5,000 worth of healthcare expenses, but if a portion of those are paid by the plan, that they don't count as the out of pocket. So in this example, like if you are Jane and you're kind of planning for your healthcare expenses and trying to budget for the year, then you would want to maybe have in the back of your mind that you could possibly pay up to $5,000 for the year for your healthcare expenses. Now, if you're someone who doesn't usually get sick, maybe you go to the doctor because you have, strep throat or something like that, and you need a checkup, the likelihood of you even maybe reaching that deductible or even reaching that $5,000 out-of-pocket limit is going to be much lower than maybe like a family that has 1 or 2 children, and that, maybe even just, your kind of day-to-day average things that happen are gonna, meet that deductible or that out-of-pocket limit much faster. So next thing I'm gonna look at, do you have any questions about any of these terms here? Okay. So next thing then, as we talk about healthcare expenses or healthcare costs, is making a plan for how much you can actually afford to pay in a year, just based on what your income and your other expenses are. So that can help you if figure out maybe how much you can really afford for a premium, and if there were to be something like a major event, like a broken arm or something like that happen, help you figure out how much you'd be able to pay. So this is just an example of a budget or a spending plan with this your standard expenses on it. But the second part here has you calculate, what would be some of your health and medical expenses. And do you regularly do like have a written budget or anything like that, Emma? Sometimes this is maybe something different to do, but it does help with the planning. If you're just kind of trying to figure out how much money you would need to maybe could afford to pay for that healthcare premium. So if you, what works really well when trying to figure out kind of a budget for your healthcare expenses is to look at what your expenses were in the past year. So if you have been paying an insurance premium out of pocket, look and record how much that was. If you were have co-pays or co-insurance costs, just making a list of how much that is. And the best way to do that is just to look back at your either like your debit card transactions or however it is that you usually pay for your expenses. If you have regular prescriptions that you purchase or dental or vision, anything like that, then it works really well to be able to just review that those expenses. Then once you have, that'll just give you a good idea, maybe once you look at what your other expenses are, to see how much money you have available to be able to spend, and maybe even just to set aside for healthcare expenses. Any extra funds that maybe you can set aside for savings that's designated specifically for your healthcare expenses can be really helpful in that planning ahead. Because one thing, we never ever plan for any healthcare emergencies. We just, but we want to make sure that we're ready for those healthcare emergencies when they arrive. All right, so another thing to consider when you're looking at your healthcare expenses is to consider health savings accounts or flexible savings accounts. And these are great options or tools related to healthcare expenses that can help an individual to be able to set aside funds to pay for those regular expenses that occur. They are like each of these type of accounts is usually available through the insurance. And sometimes you might be able to get a flexible savings account, but not necessarily a health savings account. The difference between the two is a flexible savings account is a type of account where funds are withdrawn from your monthly paycheck and they are deposited into the savings account. The funds that are withdrawn before taxes, so it helps to reduce the amount, what your taxable income is. So it can save some money down the road when it comes to figuring out how much you're gonna have to pay for taxes for the year. So flexible savings account, what you do is designate how much you want to have deposited in that account for the year. So let's say you decide each month you want to have $50 withdrawn from your account. So over the year, you would have then $1,200 set aside for paying for expenses. So the way it works then is if you have a medical expense, so maybe you go to the doctor and that office visit is $100. You can use that flexible savings account to then pay that $100 rather than paying it from your like regular checking account. And the benefit is that you know that money is set aside, and because it's withdrawn pre-tax, then it does save you a little bit of money for taxes. With a flexible savings account, there is a limit to the amount that you can have deposited into that account each year. And with a flexible savings account, you also have to make sure you spend the money in that account during that calendar year. The balance in the flexible savings account does not carry over into the next year. So what I'm showing on the screen is actually an article that is on our extension website that has more information about the flexible savings account. The health savings account works similar to the flexible savings account, except it's only you're only able to use it if you have a high deductible health insurance. A high deductible health insurance is usually where your annual deductible is over $2,000. And if you have a deductible that's less than that, then you can't have a health savings account. What's nice about a health savings account is that any money that is deposited into that account is considered pre-tax, so you don't have to pay taxes on it, and then it helps reduce your tax liability. The health savings account, that you don't have to spend all of that money in a year. It can carry over from year to year. So I know one way people have used it, if they know they have some kind of a procedure or kind of larger health expense coming up, then they put the funds into that health savings account. It does earn interest, so then they kind of get a little bit of savings there, or a little bit of earnings there, and then it's all pre-tax. So a friend of mine used this when she was going to have a baby, and so she knew what her hospital expenses were going to be, so she put that money into a health savings account. So then it reduced her taxable income, which was a tax savings, and then she was able to pay that expense in a lump sum by doing some pre-planning with that. So this article is just another way to explain that, and you can go to our extension website, which is just extension.sdstate.edu. If you actually, and you click on the little drop down of family, you'll see family finances, and that's where you're going to be able to find this article. All right, so a couple of other things that I was, and this isn't going to apply to you because it's Medicare open enrollment. This is for individuals who are over the age of 65 that qualify for Medicare. Open enrollment is, there's kind of a time period that if you want to make any changes to your Medicare plan, and it's October 15th through December 7th. And this is information about that. But what might be a benefit for you, because as a graduate student, my guess is your income is low, is for you to check out the marketplace. And this is related to the affordable health care plan that we have in the United States. So anyone who is not covered by employer insurance can access reasonably priced insurance through the healthcare marketplace. The enrollment for the marketplace is November 1st through December 15th. But what you can do is go to healthcare.gov and start looking to see what type of policy might work best for you. And it's based on your income. So the lower your income is, the less you're going to have to pay for the healthcare premium. And it's possible, depending on how low your income is, that your premium might be almost zero. So have you heard about the marketplace, the healthcare marketplace before?
I have before, but I didn't know like how to do my research and everything in there. So I wasn't sure.
Okay, so go to healthcare.gov. That's the website where you're going to find the information. And they have a ton of information to help you, kind of like tutorials to help you walk through making decisions. But I can also help you answer questions along the way too, if this is something that you look into and you see that you qualify for it. So this is
what's the eligibility requirement for like to get a health insurance to marketplace?
Can you say that again?
What's the eligibility requirement? Like, is there any criteria that I'd have to meet to buy the health insurance from there?
Your income would need to be, well, yeah, the criteria is that you don't have health insurance with another company or another, like you don't have other health insurance.
Okay.
is the only thing. So, and then
Okay.
it's going to be based on what your income is. So, but even if you have a high income, you could still use the marketplace health insurance.
Okay.
So yeah,
And the two savings account from the previous slides, are they only done through like the employers, or can I just go to a bank and ask them to open those accounts? I think I missed that part with the white
they're
horse
going to be through the health insurance company.
health
So
insurance.
you would just have to check, and not all of them have. Most are going to have the flexible savings account, but not all will have the health savings account.
Okay.
But the flexible savings account, when I was first started working quite a few years ago, I had the option of using a flexible savings account, but I totally didn't understand what it was. But now I've found, I mean, since I've learned that, I mean, it really is a good deal, because especially if you know you have regular reoccurring healthcare expenses. If you don't have any, then it doesn't pay, because you have to spend all the money that's in that account. But even if you put, figure out kind of what's the minimum amount that you would most likely spend on healthcare expenses and have that in that savings account, then it'll save you something just in terms of that tax liability.
Okay.
Okay, so there. Okay, so to learn more about the health insurance marketplace, you can just go to healthcare.gov with all that information. Here's what the health and the website looks like. And, it takes you through, like if you click on that green button, see if I can enroll, it'll ask you some questions and to see kind of how far, just kind of walks you through each step of the process with that. All right, some other resources that are very reliable. I've talked about healthcare.gov. The IRS has publications that help answer some questions about health insurance. The health insurance marketplace calculator is an interactive calculator that can help you figure out maybe how much your premium is going to be, or what your expenses will be related to the insurance you can get through the marketplace. I've talked about SDSU extension, and there's the URL for that. And then another website, but this isn't going to apply to you. It's the Senior Health Information and Insurance Education website, and it's geared towards older adults. So not applicable to you at this point in time. And then just to wrap things up, here's my contact information.